So I am Tracy Rickman. I'm the PI for the Addiction Technology Transfer Center, the ATTC, that collaborated. HealthShare reached out and partnered with us and a lot of the folks that you've met today in the community to put on this event. And we did a similar event last year, as you've heard, but with different speakers and topics and so forth. So just wanted to talk a little bit about our work because I keep hearing from folks that they're a little bit unaware of everything that we do. So you can see here up on the screen, this network is a national network. We've been funded for about 13 years, actually, through SAMHSA. And so across the nation, there's 10 regional centers that match the HHS regions. So we meet nationally as a group, all the grantees that do this work, and then we work within our region. So we're Oregon, Washington, Idaho, and Alaska. And the team of folks that I work with at OHSU, we provide services and training and collaboration in those 4 states, as well as with some national partners too. So kind of wanted to put the map up so folks could see what's out there. If you come from another area of the country, if you're interested in work going on in other areas of the country, we can tell you more about what's happening because we have unique trends, obviously, in addiction treatment and training and so forth. So happy to talk with anybody about that after the presentations today. So our ATTC grant is housed under our larger group, which partners with all of our research funding that we get, which is our full team is called the Health Systems for Innovation Group. And I just wanted to put that up so folks could see, again, where the ATTC training grant is sort of housed. So within the Health Systems for Innovation team, we do research, really health services research, clinical trials, and program evaluation. And then the ATTC falls in the lower part of where you see this on the slide, workforce training and organizational development. So we have about 9 people here in Oregon, and I'm going to introduce you to these folks in a second. And then we have folks in Washington and a lot of contract employees in Alaska and Idaho as well. So our team, this is everyone here. Some of you, so I'm Tracy, and some of you met Goli. She was here earlier. She is our Director for Development and Innovation. She worked with us, worked at OHSU with our team about 8 or 9 years ago, went off to graduate school, got her PhD, and came back and rejoined, so which is really fun for our group. This is Jennifer right here. Raise your hand. So Jennifer has been with us for a long time. She's our operations manager. So some of you have interacted with Jennifer around contracts. If you do trainings or interface with us, she manages our whole list of trainings, all the pieces of our project and our whole team. So she's really a key point person. And hopefully if you get a chance, you'll see her at the registration table as well, or say hi when you're meandering around. To Jennifer's right is Sean Ramirez, and Sean's been a project assistant with us for several years as well. He manages some of our evaluation work, the website, setting up trainings, all different kind of project management aspects of our work, and putting on events like this as well too. Then Phil's way over there. And again, a lot of you might have met Phil. Phil helped coordinate this whole event, and he's our newest team member. He's been with us for about 6-7 months now, since last summer, and he coordinated a big SBIRT training up in Washington for us over the summer and did a really great job with that as well. And then Robin's not here. Robin runs the research side of the project, of the group, and she's up at OHSU working today. This is Brianna right here. Brianna's my research assistant, and she works in both aspects, so in the workforce training and organizational development part of the Health Systems for Innovation team, and she works in the research side as well. And then Will is over here. And Will also serves as a research assistant, and he works on our coordinated care organization research study, and also some methodology projects we get pulled in, like UTI studies and all unique things we're doing. He does some methodological work around qualitative stuff for us. Marissa's not here with us. She's another research assistant. So that's our team here in Oregon. And I just wanted you guys to have a face-to-face moment with all of them as I talk through the projects. So one big body of work that we do focuses on healthcare delivery. We do a lot of development and research around identification and treatment of behavioral health disorders. And the projects I listed here are just a few things that we have going on now. So we collaborate with folks at Columbia, Emory, UGA, UCLA to implement different clinical trials or just to participate in studies as methodologists. Our team has a lot of experience with mixed methodology, so integration of quantitative and qualitative data. And so right now, these are the projects we're working on. So a care model design study, screening and brief intervention, team-based care, and implementation of medicated assisted treatment, which is a big part of what we're touching on today here at this event. We also have an NIH-funded grant looking at the CCOs in Oregon, you all are familiar with, and their impact on behavioral health services, so access, engagement, and quality of care. And within this project, I listed the key things that we're really focused on investigating and studying further. And if you have any thoughts or input and want to talk about it, I'll be at the back too. Right now, we're actually rolling out a paper on SBIRT. We've got 2 from medicated-assisted treatment. We're looking at Medicaid data and then interviews with the CCOs, and a few folks in the room here I've interviewed for this project as well. So if you have any curiosities, happy to talk with you about that more too. Another research study and workforce training innovation that we've been working on for, gosh, about 4 years now, I think, is the cultural adaptation of the therapeutic education system, which is a computer-based tool to treat addiction. This was part of a national clinical trials network study. The NIDA Clinical Trials Network did the study, found that this intervention was efficacious, and then we got funding to adapt it for American Indian, Alaskan Native communities. So because we're here in the Northwest, we have a large Native population, and with our partnership with the state of Washington, we do quite a bit of work with Native communities. So we did the cultural adaptation for this, and we have a trial, a grant under review right now with NIH to study this further and do about a 3.5, 4-year study. Our other work where we overlap with evaluation and project development, one of the highlights that we were talking about as a team, since we can't cover everything we do, is our work with Legacy Health Systems. We've partnered with them around a peer support program and done an evaluation and then spent a lot of time discussing with them how it rolled out, how it worked, how the peer helpers felt. Very, very interesting process. As all of you in the field know, that's really a hot area right now. We did a similar evaluation with Hooper, looking at their peer program with the Detox Center and the implementation of Vivitrol. And I've seen some of you before when we've presented that data around town and at national conferences. And some of you know Dr. Gregg, who's in the back there. She can tell you more about their program too. If you have questions about that, happy to answer. And within the Legacy Health System, we're also partnering with them around the development of the Unity Psychiatric Hospital, looking at data and metrics. They wanted some consultation assistance with that. Setting up research and evaluation, ongoing monitoring as they develop the hospital, and then training and peer support. And our last study I wanted to just mention, which I think can be interesting to this group because you all work in this area with behavioral health and addiction. We're doing a workforce study really looking at recruitment and retention of the workforce and what training needs are out there across the nation. So this is part of that national network on the first slide. So we're collaborating with folks all across the nation to collect this data to see what's going to happen in the future. Those of you in the field have experienced that it's really hard to attract and retain great employees for treating folks with addiction, and so we need to really assess how to prepare our workforce better early on, move it upstream a little bit for that development. So moving into just the training part of it, I get questions a lot, and our team does, about what all we provide in terms of training, so I just wanted to give a quick overview of that. Obviously, we provide SBIRT, screening brief intervention training for adult, pediatric, and special populations, brief treatment, motivational interviewing. We get a lot of requests for clinical supervision training. And then lately, with legalization, so 3 of the states in our region have, obviously Alaska, Washington, Oregon have passed for legalization. Marijuana is a really hot topic right now, so we've just developed additional trainings in that area. And again, stop by and talk to us if you have questions about any of that. It's come up more and more, what's happening on the West Coast and where are we with HIV and AIDS. And the neat synergy I like in this work, and just wanted to share with the group, is the trauma-informed care, again, obviously very relevant for today, and the work we're doing around that. So we've got a training coming up at the correctional setting in Kennewick, Washington, and then another one that's going to be here in Portland with Nikki Miller, probably April or May, it looks like that's coming up. So we'll try and keep the group here on the list in case you're interested in learning more about that. And then last, obviously ties right in, hot topics, critical need. We get a lot of requests to give talks about opioid addiction and what services are available or should be available within the care delivery system. We have a web-based medicated assisted treatment training that folks sometimes prefer, and then we provide face-to-face training just about all the different types of medications and how to implement them in different settings. And then we do collaborate to provide the buprenorphine waiver training as well. And then I mentioned marijuana. So that's the group, that's the team. If you, here's how to contact us. If you have any questions, I could just take like 1 or 2 questions, and then we're going to move on to the next presentation. Anybody curious? Yeah.
What is the legacy in emergency peer support team?
Sure, yeah. We just did an evaluation for their implementation in the emergency department with the peer support model. So we've just been collecting data and working with them around that.
You mean,
Chris Ferentinos, Rick, that crew.
Is it staff supporting one another?
Oh, no, I'm sorry. Yeah, that's a little unclear. I'm sorry about that. No, folks who come in with serious mental illness or addiction or comorbid conditions matched with a peer to help them navigate the system, not at the provider level, so no, at the patient level. Sorry, yeah. The evaluation concludes the providers, but yeah, sorry, that's unclear. Yeah, David.
Just a quick question about medication-assisted therapy. Do you know what the gap is in Oregon between sort of where we're at in terms of number of prescribers and the accessibility of Medicaid versus what would be more of an ideal situation on track? Are we close to having enough? Do we need a whole 3 times as many? Do you have any of that data?
Numbers-wise, so David's asking, I don't think that was on, I don't know, I could barely hear you, asking about the gap in the number of folks waivered, are you asking, to provide medicated-assisted treatment? I know there is still a gap. I've asked SAMHSA for the data on the total number of people in the state of Oregon, at least, that are waivered, and they're not actually able to provide that for me to date, so they should be able to. So pushing to get that, but that's a really good question, and we can look into that and share that with the group if we can find that. So certainly I hear constantly that there's a gap. As most of you know in the room, there's a much, the question there is we get a lot of folks who get trained and receive the waiver to prescribe and then don't actually go on to prescribe. So we need to address that issue and what support folks need to actually implement and start prescribing. Feel comfortable with that. Yeah.
So are you doing anything in particular around the foster care population?
No, we have not, but we would be happy to partner. We've had a few folks reach out to us to see if we could provide certain trainings, like Addiction 101 kind of stuff is actually the one that's come up that I'm aware of. So, but no, we haven't partnered. That's another great population. Thanks for asking.
Okay, I'll talk to you later.
Yep. Yeah, thanks. Anybody else before I go? All right, thank you.